Good afternoon, everyone. I'm Tina Shaw. South Carolina Governor Henry McMaster is holding a briefing with public health officials right now. They are updating the public on the state's response to the coronavirus. Let's join the briefing in progress.
All state taxes, and that includes income taxes, business taxes, sales taxes for small as well as large businesses, admissions taxes, motor fuel taxes, and any tax I've left out. The idea behind this is to allow these businesses to maintain their cash flow during this crisis in order that they may be able to pay their employees. Now, those rules are a little bit different from the federal rules, but the Department of Revenue has a website with details, and so does the Federal Revenue Service. Restaurants and bars, now this is a requirement. Restaurants and bars must close their dine-in service starting tomorrow. That is, tomorrow morning, no more dine-in service. It is allowed and recommended that takeout, curbside delivery of food to homes, businesses, takeout, all of that be increased and enhanced wherever possible. This decision was made in concert with conversations with a number of people, including John Durst, who's the director of the South Carolina Restaurant Association, and Chairman Bobby Williams. And we've talked to a lot of people. We know this is a dislocation. We know a lot of these things are going to cause problems for businesses, but the enemy we face, this enemy of this virus, is bigger than any sort of irritation or inconvenience that any of us could have. So we are asking people to stick together and understand that we're in a crisis and we need to take these measures. I'm also I'm prohibiting organized events of 50 or more people to be held in any state, county, city, or publicly owned facility. I'm requiring the National Guard to begin coordinating and planning with the hospitals for mobile facilities, to build infrastructure, to acquire resources. This is a plan. We're not doing this, but we're making plans. Our goal is to stay ahead, to think ahead, and to stop this virus. Also, DHEC will waive regulations so hospitals can use medical and nursing school students to help in their operations. Now, those that I've mentioned are requirements. Those are mandates that will be included in my executive order. I'm also requesting some things, not requiring, but recommending and requesting things. That is, the South Carolina Medical and Surgical Centers halt all elective and non-threatening surgical and medical procedures within the next 72 hours. Why is that? That will allow for medicines, equipment, space, things like masks, and all those sorts of equipment and personnel to be used by the hospitals to treat those who come into the hospital with this virus, and they'll have room and have capacity to do that. I'm also I'm requesting South Carolina insurance companies to pay 100% of the costs associated with a coronavirus doctor's office visit. That is, we want those visits to be free for the patients. This means that there will be no payment will be required for things like x-rays, tests, and procedures that are done in connection with testing and determining the presence of the COVID-19 virus. South Carolina insurance companies are requested to incentivize doctors to treat patients with non-COVID-19 issues by telehealth rather than in person. That is, if it can be done by telehealth, if it can be done without an in-person visit, do that. That will allow space for those who do need to come in for appointments for the COVID-19 patients. I'm also requesting grocery stores like Costco, Walmart, Target, and all the rest to limit customer purchases for things like paper products, disinfectants, water, and those kind of things. We're experiencing right now where people are rushing in and buying way more than they need, and that is limiting the supplies for other people who have none. So, ladies and gentlemen, people of South Carolina, be courteous, be smart. We don't need to hoard all of these supplies. Let your neighbors have access to them as well. I also would like to recommend, as they've done in some places, to have senior hours for people, for our seniors to come into these stores so that they are not in the presence of all the rest of the customers who would be there. That will give our seniors the comfort in coming in without worrying about catching the virus, because as you know, it is the seniors and the older people, particularly those with underlying chronic conditions, that are most vulnerable and susceptible. And also, I'm asking every private employer in South Carolina, asking every private employer in our state to allow workers to work remotely if they are not 100% essential to the operation of the business. We've already done this for all the state government offices, and we're asking the private employers to do that as well. So if they don't need to be there, if it's not absolutely necessary for them to be there, let them work remotely as much as you can, and that will help us control this virus. Now I'd like to call on Superintendent Spearman.
Thank you, Governor. Thank you, Governor. Since the Governor made his announcement Sunday afternoon that all schools in South Carolina would be closed, there have been lots of things happening. One superintendent called me today and said, the reason I like to be in education is because I can give my folks an impossible task and they can do it very well. And I know that's not just true of education, but all of our service providers, our emergency folks, our medical folks. So I thank you to all of them, but especially the teachers, principals, superintendents, volunteers who have been coming in to help us. We have sent out instruction packets all across the state. Students are working on those. Our e-learning process is working very well. Yesterday and today, we have approved over 600 feeding sites across South Carolina, using 1,000+ buses to deliver meals to those students who could not come or drive by. To see where those feeding sites are, you can go on the website of your local district or the State Department of Education's website, which is ed.sc.gov, ed.sc.gov. Our partner, South Carolina ETV, announced today that on Tuesday, March the 26th, they will change their programming from 8 a.m. to 6 p.m. It will be filled with instructional programming, content area programming for all age levels. I'd say to parents, though, right now you can use ETV particularly in the mornings for your youngsters, your young learners, and there are some times there where content material is given, but that will be extended beginning March 26. And parents, one of the things that I would like to ask you to do is to take some time and really just talk with particularly your young learners. They're not on social media, so they're at home now and they may not understand all of what's happening, a lot of stress. And I know it's stressful on you as well. We have posted on our website, ed.sc.gov, some tips that have been given by the American Society of Psychologists. I think they're very, very good, and I'd ask you to take time to speak with your children about this. It's very frightening, but we can get through this together. People are stepping up to the plate. And finally, I did send a letter today to the U.S. Department of Education asking for a waiver on our federal mandated testing. I anticipate hearing back from them. Other states are following in that, and we will keep you posted. But we're also, at the governor's direction, looking at all of our regulations, and we will be asking for relief of those that we need to use to meet the needs of this pandemic and to really support our families and students in the proper way. So thank you, Governor.
Thank you, Ms. Spearman. Dr. Linda Bell, Department of Health and Environmental Control.
Yes. Thank you, Governor. Good afternoon. As an update, DHEC is now reporting a total of 47 cases of COVID-19 in 13 counties across our state. This includes 4 from Beaufort, 3 from Charleston, 1 from Calhoun, 22 from Kershaw, 2 from Lancaster, 1 from Fairfield, 3 from Lexington, 1 from Richland, 1 from York, 1 from Spartanburg, 2 from Anderson, 2 from Greenville, and 4 from Horry County. Sadly, this includes our state's first reported death of a patient who recently had been reported to having been diagnosed with COVID-19. The patient was an elderly person from Lexington County and was a resident of Lexington Medical Center Extended Care Skilled Nursing Facility. The patient had underlying health issues prior to testing positive for COVID-19. Because of these underlying medical conditions, we do not know the exact cause of death. We reported on the patient's death yesterday. We are continuing to work with the facility to identify all contacts and are providing guidance about infection control measures to prevent possible spread. While we have been expecting a day in which we would have to make this announcement, it's never easy to have to report on the death of a fellow member of our community. On behalf of all South Carolinians, we want to express our deepest sympathy for the family and loved ones of this patient. This loss is a reminder of the importance of taking precautions to protect those at higher risk, like the elderly and people with serious underlying health conditions from exposure to illness. As South Carolina's lead public health authority, our top priorities remain preventing the spread of disease and protecting the public's health. As of late yesterday, DHEC's Public Health Laboratory has conducted 456 tests. 47 are positive and 409 are negative. This did not conclude the negative tests performed by other reference labs. We know that many South Carolinians are concerned about what impact the virus may have on themselves, their loved ones, and on our state. We are currently only seeing ongoing transmission in one county, Kershaw County. We want people to be prepared and to remain calm and rational as more cases occur. Recognize that the majority of illnesses are relatively mild, the type of illness for which individuals may not normally even seek medical care. Based on what we know so far, the CDC expects that many people in the United States will at some point, either this year or next year, potentially be exposed to the COVID-19 virus. This will include residents here in South Carolina. However, it's important to note that most people will likely not develop serious illness. While this is occurring as we expected it to, we still must continue to take measures to help safeguard against illness, including practicing good hygiene, like frequently washing hands, and we mean thoroughly washing hands for 20 seconds. This is just a visual between the fingers with soap and water every time you touch a surface when you've been in public or your hands are potentially contaminated. That's one of the most important measures in preventing the spread of disease. We also remind people to cover your cough to prevent the spread of respiratory droplets. Individuals with signs of illness are asked to take seriously the recommendation to stay home from school and work and not attend public gatherings. We do not recommend that everyone who is ill get a test to see if they have been diagnosed or if they have COVID-19. And if disease activity increases significantly, we will advise people to stay home, get better, and seek medical care if symptoms are worsening. This will allow our healthcare system and our healthcare providers to give care to those who need it most. This will likely be an extended response. Please know that our public health professionals are constantly monitoring our epidemiologic data and following CDC guidance and recommendations for strategies to slow the spread of disease in our communities. As cases increase, we are prioritizing identifying the close contacts who are at high risk of illness to those who are known to be infected and are more likely to suffer serious illness. This includes our nursing homes and assisted living facilities, as well as other vulnerable populations with unique circumstances. We, like other states, are also beginning to practice social distancing for communities as a whole. The number of cases that ultimately occur will depend in part on all of our efforts to practice good personal hygiene like hand washing and protecting others by staying home when ill. Please know that our public health professionals are constantly monitoring our epidemiologic data and following CDC guidance and recommendations for strategies to slow the spread of this disease in our communities. We also continue to work with federal, state, and local partners to prepare and respond to this situation to best protect the health of the residents of South Carolina. And I would like to thank all of our public health professionals who have been working around the clock diligently since we first recognized spread in the United States. They are investigating reported cases, they're following up on the contacts of known cases, and educating the public on steps they can take to help prevent the safety and health of our state. And I'd also like to thank our healthcare providers who are working compassionately to meet this significant increase in the demand for care. We are still learning about this virus, and we are committed to keeping the public informed. As we learn more, we will continue to provide updates as quickly and as timely as possible. For the latest information, I encourage you to visit our website at scdhec.gov/COVID-19. Thank you.
Thank you, Dr. Bell. Are there any questions?
I have a question for Dr. Bell. I know you said
Oh,
that.
wait a second. Dr. Bell?
I know you said that things have moved the way you guys expected them to thus far. What are you all expecting now? What can we expect?
And that is difficult to predict, and it depends largely on how successful we are in implementing these community mitigation measures, and so community containment measures. So that to the extent that individuals take very seriously our recommendations that they do not go in public while ill, and that they are very fastidious about hand washing, about personal hygiene, that can significantly impact the spread of disease and can slow the spread of disease. And so it's difficult to predict, but these additional measures we hope will slow the spread.
Dr. Bell, is the newest Lexington County case also connected to the extended care facility?
The newest Lexington County case that we were reporting was a known contact to a previously reported case.
Can you be more specific than that?
No.
Governor,
Yes, sir.
we're hearing that a lobbyist at the State House has contracted the coronavirus, a lobbyist who was in the State House as late as last week. Are any special measures being taken at the State House because of this?
So regardless of who becomes infected that comes to our attention, we recommend the same measures. We ask those who are diagnosed, if they can stay home, they can stay in self-isolation at home if they do not require medical care. We ask that their close contacts remain in quarantine for 14 days after the last contact with someone who is ill, and to not go in public places, to carefully monitor for the signs and symptoms of illness. So the measures are the same for each new case that we identify. In public settings, we do not seek to identify all individuals who are in a large public gathering, because we don't consider all the individuals in a large public gathering to be exposed. So it is the close contacts of individuals that we focus on for specific disease measures. For specific disease prevention measures.
Governor?
Yes, ma'am.
Dr. Bell, can you say how many tests have been conducted at this point, not just the number of tests that have come back, and whether there might be a backlog?
So DHEC is able to report on the total number of cases performed, both positive and negative. Private reference labs report positive reports to us. We don't know the total number of tests performed by private reference labs.
Governor,
Question?
right, Governor, what are you guys advising child care centers to do? And if you guys are advising anybody, what are you advising the workers in high-risk categories to do as well?
What we're advising individuals in I think you're asking about high-risk settings like child care, is that correct? So we do consider certain facilities, certain situations to be higher risk because they are congregate settings, and so, for example, in a child care setting, there are young children who don't practice good hygiene. They're in close contact with one another for many hours during the day. So we have specific recommendations for settings like that. from everything from environmental cleaning, for monitoring for illness. We ask that if child care centers remain home, that they monitor and inform parents about signs and symptoms of illness, that they not send their children to a child care setting if they have any signs of illness. And those are some specific measures that we take for settings like that.
Those are still applying to workers in those child care centers as well?
Yes, actually they apply to all staff, to all assistants, to everyone connected with the facility.
Dr. Bell, can you say if there has been additional spread at that Lexington County nursing home? We had one report yesterday of a Lexington County case of an elderly person who had contact. Now you're saying there's a third case in Lexington County. Any spread in that nursing home?
So I do not have details to report on each individual case, but we do know that the first 2 cases reported from Lexington County were known contacts.
As you expect this to spread, do we have enough ICU beds, respirators, and ventilators in the state of South Carolina?
You want to answer that? This is Dr. Toomey.
So the question was, within the state of South Carolina, do we have enough ICU beds or ventilators? It will depend upon the severity of the illness. I think the steps taken, although elective admissions and elective procedures being curtailed, will help the staff and be able to focus their care on the critically ill. It's going to be a day by day. We monitor the hospitals every 6 hours for their census. So we've activated the reporting system for hospitals to give us their status on hospital beds.
Do you know how many beds we actually have, ICU beds?
As of this morning at 10 o'clock, we were in the green category, so there was not a shortage in any one hospital that reported.
Governor, would the National Guard be activated to build temporary medical facilities if hospitals are overcrowded?
That is the purpose of the plan that we are developing. We've not gotten to that point, but we are doing all we can to stay ahead. So we are planning in a number of directions for a number of contingencies, and that is one of them, yes.
Governor, I know that you said that you are making some changes as far as restaurants and bars. At what point are we going to move from recommendations of people not going out to curfews and mandates on that?
Those are not recommendations. That is in the executive order, that the restaurants and bars will close. The dining facilities, but not for takeout.
As far as people going out and curfews, when will we see something like that? Like
All such measures are options that are on the table. We do those things, implement those things as they become necessary.
Governor, should lawmakers suspend session, in your opinion, the legislative session?
They are, today the Senate passed the $45 million request for DHEC, and the House is coming in on Thursday and to do the same thing. That will give us $45 million in addition to what we're receiving from the federal government to make sure that we are strong in our defenses and the operations, particularly of DHEC and in the health care. But we're going to do everything we can to see that we have all of the resources available to do whatever is necessary to take care of the people.
Should they suspend session?
They are going to do that. The House is on furlough, I believe. That will be up to them, but of course, when they come back, they are limiting that to only the essential personnel. We need to do the business of the state, but we need to be very, very careful.
Dr. Bell.
Yes, sir.
There was a case reported out of a hospital in Georgetown. Is that the new case in Horry County?
We're reporting cases by the county level, not by the facility.
What about funeral directors, embalmers? Should they take special caution when embalming bodies or people who have died because of the virus? And then what about funeral homes? What is the legal liability for them having funerals if someone should come in to view a body or during that service and they're sick?
Well, funeral directors, like healthcare providers, are advised to always maintain universal precautions. So regardless of a known cause of death, they follow specific measures at all times when handling human remains. With regards to funeral services, we would follow the same recommendations that we are making for all community gatherings to avoid non-essential gatherings, and so that would be left up to the personal preferences of families and communities on a case-by-case basis for special situations like that.
Governor, if I
Mr.
could,
Beard.
I'd like to ask about grocery stores again, because this is a big deal out there with the public right now. These stores are swamped, overwhelmed with shoppers. I know you touched on it earlier, but what would you tell South Carolinians about going to the grocery store and how to act when they go inside?
No, that would be for you.
Go ahead.
Could you repeat the question, please?
Grocery stores are overwhelmed right now with shoppers, panic buying. So we were wondering, the governor touched on it earlier, what would the message be to South Carolinians going shopping in these grocery stores right now as the panic buying continues?
Well, we're providing as much information as we can to prevent people from panicking. We're asking people to remain calm, to behave rationally, to make purchases to meet their basic needs, their basic immediate needs. There's no need to stockpile resources. We do ask people to also behave responsibly in public. If they're ill, have someone else get those groceries for them, use services for the delivery of groceries.